All right, thank you so much everyone for joining us today. As people log on, I thought we could just get started. We have a lot to cover today. So welcome. This is a joint session of the Healthcare for All Minnesota, Minnesota Nurses Association, and Physicians for a National Health Program Minnesota Education Series. We will be focusing on social media for newcomers. So everybody's welcome. We're glad that you're here. Part one starts today. So we will be having a 3-part series and we'll talk a bit more about that later. All right, so today's agenda, we're going to start with a poll. We'll get to that in a second, just to get everybody's knowledge base understood to see where we're going. We're going to do a content overview, followed by what is social media. That is going to be led by Diana Gila. She is the intern this summer for PNHP. After that, we will hear from Carolyn Hanke, who is the intern for Healthcare for All Minnesota this summer. Jessica Koffenberg, the program coordinator for HCAM, will follow up with sharing current content online that's available for everyone. She'll be doing that before our open Q&A. And then at the end, we'll talk about resources and future presentations. So first, our poll, we're going to launch a poll. So if everyone can go ahead and share with us, answer these questions that will pop up in front of you. And then we will share the results at the end. So if you want to just take a few minutes and look through those, answer as best you can. If you have any questions, let us know. All right. So we have a few more people that still need to answer. Give everybody some time to read through those choices. As people are logging on, welcome. We're so glad you've joined us. There is a poll that should be up on your screen. Feel free to answer those questions, and then we'll share the results with everybody here. This is just about experience with social media. All right, we'll keep that open for one more minute as we have a few more people joining us. All right, let's go ahead and share the results. Okay, so Jessica, let me know. This should be showing the results for our poll. How much experience do you have with social media? We're about 50-50 with a little bit of experience and complete newbie. So this is the perfect place for you, and we're so glad that you're here. We hope we can help you out a bunch. Next, we have, are you on Facebook? We have a big mix, a lot of folks on Facebook. Some people not sure exactly how to use it. Hello, everyone. This is Jessica. Are you on Instagram? A lot of us are not. So we will have a lot of great lessons about Twitter, about Instagram, and Twitter is the same. So really excited to get to talk about all of those things. Wonderful. Well, we will move along. Thank you, everyone, for being involved in the poll. All right, so our workshop overview. Our goals for our workshop series is to educate advocates about the power of social media. So that's going to be the focus of our training, especially today. We're going to help newcomers to choose the platforms that work best for them, share best practices for different outlets, different platforms, and then we're going to create resources for new users. So you'll be able to find the video of this workshop and our other workshops on YouTube if you ever need to come back and watch again, need any tips or tricks or anything like that. So today's focused on why social media. Our next workshop will be focused specifically on Facebook and Instagram. So if you have very specific questions about those platforms, make sure you come back in 2 Wednesdays from now. On the 18th, we'll be talking about that, and then we'll focus only on Twitter on September 1st. So we welcome everyone to join us again for those. So before we begin, I just want to talk about the power of social media and how it is currently transforming advocacy. If you've been doing this for a while, if you've been supporting the movement, you know we do a lot of tabling. So I'm going to use our most recent tabling as an example. So we did Pride a couple of weekends ago. It was 2 days out in the hot sun. We had about a dozen volunteers that talked with thousands of attendees. So we spent hours speaking with individuals, sharing information, and getting contact info for ongoing communications, which is super important for our movement. We collected just about 600 names on a petition, and about half of those people also gave us their contact information. So that was about 2 days, about 16 hours worth of work, plus the planning. Alternatively, on July 6th, PNHP Minnesota posted a Fox News article on Facebook. It took about 60 seconds for one person to post one article, and here were the results. We had 4,000 people see the post, and 579 people engaged with the post. So that means they liked it, they commented on it, or they shared it. So we had just about the same outreach. That's pretty powerful. The quality of the engagement might not be the same as a face-to-face interaction, but it's very valuable for sure. So how does that work? PNHP Minnesota doesn't have 4,000 friends or followers. So how did all of those people see one post? This graphic shows you the power of social media. You can see one person posted something on their social networks. Their friends and followers shared with their friends and followers, who shared with their friends and followers. And that's how we ended up with having so many people see one little news article that took us very little time to even post. So next, we're going to have Diana share with us what is social media.
Hi, everyone. I'm Diana. I'm a second-year med student at Mayo Clinic, and today I'll be giving a short presentation on just an introduction to social media. So what's social media? Basically, it's websites and apps that let users create and share content or participate in social networking. People can use this both on their computers as well as on their phones. So just on the power of social media, people are more likely to remember a story than a statistic. 5% of people remember a statistic, while 63% remember the story. And social media, because you can share so much content and different types, is a great opportunity to share those stories. And 14% of Americans have changed their mind because of something they saw on social media. So it's a really great opportunity for advocacy. So social media has a really big reach. Globally, about almost 4 billion people use it, which is about 48% of the global population. And on average, people spend about 2.5 hours on social media a day, which is actually more than twice the amount of time people spend eating. So it's quite a bit of time. In the US specifically, about 70% of the American population is on social media. And the average social media user is connected to more than 600 people, which means that if you have 10 people sharing content, then that audience can be about 6,000 people who could potentially see the content. So in healthcare specifically, about 99% of hospitals have an active Facebook page. In terms of physicians, more than 90% use social media for personal reasons and 65% use it for professional reasons. So just to get into terms and a little bit about the wording of social media. So first, in terms of what you can post, you can post obviously like writing, as well as pictures, videos, links, and as well as phone numbers. Like if you want someone or if you want people to call their representatives, you can share that information on social media. So sharing. Almost every single platform allows people to reshare other people's posts. Some tips for getting people to reshare your posts more are using hashtags, using language like retweet this or share this. And if you use more relevant searchable terms, especially on LinkedIn, Pinterest, or Twitter, that can also increase your reach. So generally on most social media sites, you just have followers, which are people who see all of the posts that you have and it shows up on their social media when they open it. But Facebook and LinkedIn are two websites that tend to have slightly different meanings for different types of followings. So on Facebook, friendship is between two personal profiles. Follows are as well. Fans are personal profiles following business pages. And so for LinkedIn, follows are personal profiles following business pages, and connections are between two personal profiles. So social media feeds are basically the name for what people see once they open the app or the website. And generally, if your posts get more engagement or it's a personal friend or just a page that people have engaged with more, then your post is more likely to show up higher on that feed. A feed can also mean a little widget or a part of a website that displays all of your social media activity. So that's another definition of feed. So just some platforms to consider include like Facebook, Twitter, and I'll run through them now and I'll do it in order of popularity. So the ones that come first are more heavily used. So as I just mentioned, Facebook is the most commonly used platform. You can post basically any sort of content, writing, which doesn't have character limits, pictures and videos are also included in what you can share. And generally, Facebook has an audience of 25 to 34-year-olds, and it has a higher older engagement than most other platforms. Instagram is the second most used social media platform. And this is very graphics based. This is an example of what an account page looks like. Using captions is also pretty important just for creating reshareable content. And this platform has a higher engagement amongst 18 to 24-year-olds compared to Facebook. But like Facebook, the highest engagement is from 25 to 34-year-olds. So Twitter is next up. This is most commonly used by a younger audience of generally 18 to 29-year-olds. And Twitter does have a character limit in terms of sharing you have, I think, around a 200 character limit, and hashtags are a big part of this platform. Pinterest is also another commonly used platform, not super useful for advocacy because it's mostly curating aesthetics and pictures of different products, but I've included it here for completion. So Reddit is the next most commonly used social media platform. And generally Reddit is organized around subreddits, which are groups of people who are interested in a particular topic. It also provides opportunities for people to answer questions from others. Ask Me Anythings, which are also called AMAs, are also common. Here's a graphic of a AMA that Bill Gates did. And generally the age of people who use Reddit tends lower at 18 to 29-year-olds. Snapchat is also a commonly used social media platform. It's not the most useful for advocacy because it is mostly centered around one-on-one interactions. But the way that organizations can take advantage of this is creating stories, which are basically videos of curated content that people can click through on their home screen. This tends to be a platform that has a younger audience at around 18 to 25-year-olds. Next is TikTok. Also not the most useful for advocacy, but it does have some potential. People tend to just include TikToks of mostly like dancing or humorous content, but you can also create like challenges and stuff like that on TikTok. This has a really, really young audience at mostly teenagers and young adults. Last up is Doximity. So this social media platform is primarily for healthcare professionals. It's still sort of on the upswing and has about 1 million healthcare professionals on there. So this is a platform where you can share content that you want doctors or generally healthcare professionals to see, but it's not currently possible to create a page for an organization.
All right, thank you, Diana. Diana has been creating content this summer, and we are really, really happy to have her on our team with us. Time for another poll. So I'm going to just stop my screen share here for just a moment. And let's go to a poll just about things that we just learned about different platforms. So you should all see on your screen the question, what platform interests you the most? She did a broad overview of the major social media platforms. So just with that brief knowledge, what interests you most? All right, we'll take a little bit more time. Feel free to choose your option and then click submit. This is a good time as we wait for people to answer the poll. You'll notice at the bottom of your screen, there is a Q&A button. If you have questions that you'd like us to answer during this workshop today, please feel free to open that and you can ask your question there. All right, so let's close this up and take a look at the results. All right, so you can see Facebook is about half of us are really interested in Facebook. Twitter's up next, and then Instagram. We are going to be talking about these three in depth over the next few weeks. So I'm really excited to share more of that with everyone here. So let's go back to our presentation. Okay, so I just wanted to take a moment and if I can get this to go here. Just give a little tip and trick. So Diana mentioned hashtags, and I know that this is something that comes up a lot. So I wanted to make sure that we just quickly touched on what a tag and what a hashtag are. So it's basically exactly what you'd think. They are tagging content or people. And so what that does is it connects the content that you are posting with the content that other people are posting. So using a tag or a hashtag makes your content searchable. So that means that your friends can see your posts at all times, but this makes your content searchable to other users. So some examples here are hashtag Medicare for all, hashtag M4A, hashtag single payer. Those are hashtags. If you tag a person, for example, at Bernie Sanders, that gets your content on his feed. So anyone searching for at Bernie Sanders is going to see what you post. That makes your voice very powerful. So here's an example. You can post the Medicare expansion is a real step towards single payer healthcare reform, aka Medicare for all. Contact Tina Smith today. This post would be viewed by your followers and friends. If you use hashtags and you tag Tina Smith, that makes your content available to anyone interested in those specific topics or people. So just something to keep in mind, and we're going to talk a lot more about that later today and at our future workshops. Now we're going to hear from Carolyn Hanke, the intern for Healthcare for All Minnesota. She's going to talk about why social media is important and what that organization has been doing recently to get on people's radar.
Hi, so I'm Carolyn. I am the intern for Healthcare for All Minnesota, and I am doing social media with Jessica, and I primarily am focused on the Instagram page. I'm a grad student at the University of Minnesota. I'm studying public health, and my emphasis is on community health promotion. I have always been interested in a universal healthcare system since I started my undergraduate degree. And then now I'm just trying to get as involved as possible and figuring out how we can improve our healthcare system and fight for a single payer. So the posts that I mainly create are focused on education, outreach, and like promoting events and call to actions. So this presentation I'm giving you is about why social media is important for our fight to a single payer system. And as you can see on the screen below, we have our main focuses are on Instagram, Facebook, LinkedIn, and Twitter. So our focuses, like I said before, are on education and outreach, and then we're trying to boost our current call to actions. So for education and outreach, we want to post information that people might not know about with our current healthcare system, and then also what a different healthcare system, such as a single payer system, could look like. So we're trying to get the word out about what this could be. And with social media, we can reach thousands of people and have like multiple people reshare our posts onto their like private pages or their own personal pages, and then that will get shared even more. So we can just reach a really big audience by sharing on our own platform. That can be in the form of resharing on Instagram, like in like people's stories, or even reposting things. On Twitter, that would be retweeting. On Facebook, that would just be sharing things based on your own feed. So then our posts are getting sent to multiple different people's feeds, and then they can hopefully come and join us in our fight. And then we're boosting our current call to action. So anything that we're doing internally with Healthcare for All, or like anything that Healthcare for All wants to do, such as like a fundraiser or events that have been going on, such as Pride that we were just at last week, we can boost that on our social media and hopefully get more people signed up and more people to attend those events. So this is an example of where we're at currently for our a few of our different platforms, like such as Twitter. So you can see on Twitter a few of our tweets. This is about Window Potter on the top, and then about Ilhan Omar on the bottom. And we've gotten over like almost 24,000 impressions. That's people who have seen the post multiple times for the Wendell Potter event. And then we had almost 40,000 people see the post about Ilhan Omar. Ilhan Omar for just thanking her for signing the Medicare for All Act. And so you can see the different analytics here about the amount of people who retweet it, the amount of people who like it. So this just like boosts our content even more and just spreads the message. Again, on Facebook, we have about over almost 5,000 people that we've reached. And then on Instagram, we have almost 4,000 people that we've reached on these platforms. So we're just kind of beginning. We started this project in May, and we're trying to just like boost it as much as we can. And so this is like a great way of showing that how much we've been able to do in the short period of time that we've started. So then another thing that social media does, and why it's important to stay on social media with our fight for healthcare for all, is it creates a database for anyone to look back and see all of our old posts. It's all public because we're a public page on Instagram and Facebook, Twitter, and LinkedIn. So if anyone's like just finding us, they can go back and scroll through for like the months that we've been on there, posting educational content and things like that. So it's really nice for people to just see what we've been doing and kind of using as like maybe a resource that they can scroll through and see anything. And like I've kind of mentioned before, it expands our audience a lot, just like, so we're not just focused on people who are using email. When we were at Pride, a lot of people told us that they weren't using or checking their email a lot, but they were checking their Instagram, Facebook, and those type of social media content platforms. And so by going on social media, we're like reaching tens of thousands of more people than we could be through email. Like I said, we have the resharing options on all different platforms. And so we can reach someone's friend from home who might not even think about a universal healthcare system because one of our followers had reshared something. So it just gives us a huge audience that we can promote to. And then lastly, it makes advocacy more fun and accessible. By using Instagram, it's kind of a low stakes way for people to stay updated to what's going on in the healthcare world and how they can be involved. We have options for people to fill out letters to send to legislature for them to like pass policies, or even just tell their friends and family to stay active and engaged about healthcare. And it's fun to make different types of content. We've made a few videos before. We make posts like this that's just kind of like someone holding up a sign. So it's just a nice way to create fun content and make this work really accessible. Thank you.
Great. Thank you so much, Carolyn, for sharing that with us. Carolyn has been working with Jessica for the past few months, and we are going to hear from Jessica next. She is going to be sharing with us where you can find content to share. So as we get started with getting you on this social media journey, you don't have to create it yourself if you don't want to. If that seems like a lot of work, you can just share what we are posting. We will be sending out these pages to you after the presentation today, so don't feel like you have to take it all down now. But we are going to jump over, and I'm going to introduce, this is Jessica here, again, coordinator, project coordinator for HCAM. She is a great resource for all things social media, and she's going to take us through some of our sites now.
Thank you, Jen. Good afternoon, everybody. Like Jen said, I'm going to go over 3 different platforms that we use at Healthcare for All Minnesota. So let me just share my screen really quick. Okay, so the first platform I'm going to go over is Facebook. So this is the most popular platform for Healthcare for All Minnesota. And so once you sign up for an account, how you can find our page is if you go to the search bar at the top here, and if you type in Healthcare for All Minnesota, it is going to take you to our business page. And then if you scroll down, you can see here that there's the option to like the page. So that's the first thing you want to do. When you like the page, that's going to ensure that you see our posts and events and everything on your newsfeed. And I have heard from some people that you don't see the information on your newsfeed after you've liked our page. So what you can do to ensure that you see our posts, if you go to follow settings and you click on favorites, this will ensure that every time you log on to Facebook that you are going to see our content higher up in your newsfeed. You can do this for any pages that you follow. This is a great way to make sure that you're seeing the content. So you just click favorites and then you update. And then if you scroll down further on our page, you can see posts. So here you can see an example of a post. And here you see that there's text in the post and then there's images. So as a user, you have, you can like the post, you can comment on the post, and you can share it. And we will be going into greater detail at our next webinar on the 18th for Facebook to show you the different ways that you can share this, sharing it to your news feed, to your friends, to, just to one individual. We'll go over all those different options, but this is just a high level overview of Facebook. Next, I'm going to show you Twitter. So once you have a Twitter account, you'll log in, and then this will be your homepage for Twitter. So if you go over here and you type in Healthcare for All Minnesota, it's going to take you to our page. Then here, you're going to want to follow the page. So click follow, and now you're following. And now you're going to scroll down and you can see our content. So here you can see, so this is the same post that was on Facebook. All these posts right here. I'm just going to come down to one with some hashtags. Okay, so here's a post, and here you can comment. It's called reply here, but same functionality as Facebook commenting. You can retweet, and you can like, and you can share. And again, we'll go into more depth on sharing in our Twitter workshop on September 1st. But here, I just want to go over, Jen did go over hashtags, but hashtags are a symbol that is used before a relevant keyword in a phrase, in a keyword or a phrase. And people put this in their posts to categorize those posts and help them show up more easily in search. So when you click on a hashtag, it's going to take you to other posts that are associated to that hashtag. So here you can see that I clicked on Healthcare for All, and it's going to show me all other posts that are associated with this. And then if you wanted to click on another hashtag, so let's just say Healthcare for All now, type that in, hit enter. Now it's going to show me posts associated with that hashtag. So you have two options on searching for hashtags. You can see them within a post, and you can also use the search functionality in Twitter to find that. Next, I'm going to go over Instagram. So Instagram is more photo heavy, and you do have some similar functionalities as Twitter as far as hashtags, but the first thing you're going to want to do after you sign up for Instagram is you're going to want to look for Healthcare for All Minnesota. So again, if you type in the search bar Healthcare for All Minnesota, it'll populate, and then you click on it. And then you're going to want to follow. So if you select follow, then you'll now be following the page. And then if you scroll down, you'll see that there are posts here as well. And within this, you have the capability to like, comment, and share as well. And then also there's the functionality of hashtags. So again, so you'll see that we posted some hashtags here. So if we click on single payer healthcare, it'll take you to a page and it'll show you all the posts associated to single payer healthcare. And here you also have the option to follow this hashtag. So when you log into Instagram, you will see in your newsfeed the hashtags you are following. Another way you can do it is you can also type it in the search bar here. So single payer healthcare now. And so anything, any topic you want to look up, you just put in the hashtag in here and it'll populate. And that is all I have for the high level overview of the platforms that we use, but make sure to sign up for our next two workshops. On August 18th, we are going to do a deep dive into Facebook and Instagram, and we are going to talk about utilizing posts, stories, groups, and pages and sharing. And then on September 1st, we're going to talk more about Twitter, and we're going to go over the basics of tweets, retweets, hashtags, and how to link your content with other users. Thank you very much. So I think now we're going to have some time for some Q&A.
Yes, and so we do have some questions that have come up. So I will share those, and then Jessica is going to kind of take the lead and answer those for us. So one of our attendees had a question about using multiple platforms. Jessica, should I use just Facebook or just Twitter, or tell us about the functionality of all of these platforms and how to use them together?
You know, it's definitely, it's good to use all the different platforms. You know, as we discussed before, there's benefits of each one. So I think that, you know, you can start with the one that you feel most comfortable with. So I think Facebook and Twitter would be a great, two great platforms to start with. And yeah, I mean, I don't think that there's any limit on how many platforms you want to be on. So definitely sign up for them all, and then make sure that you like our pages, you know, Healthcare for All Minnesota and PNHP, so that, like Jen said, you don't have to start off, you don't have to create your own content. You can just share our content, and that makes it easy.
Definitely. And feel free to post the same content across all platforms. You don't have to come up with something unique for each one. When you like, for example, PNHP Minnesota, what we post on Facebook, we also post at the same time on Twitter and Instagram. And that's just so that we get our content out there to as many people as possible. So Jessica, I know you mentioned news feeds. Do you want to tell our newcomers a little bit more about what a news feed is and why it's important?
Yeah. So a news feed is a term for on Facebook, and a news feed is a place where you're going to see all of your friends and then the different business pages posts. And there is an algorithm that Facebook uses to prioritize the posts in your feed. So that is why I was mentioning that it's really important, if you want to make sure that you see Healthcare for All Minnesota, PNHP content, that you go in and the profile settings and set that as favorite, so that it's always showing up at the top. Because Facebook is very intelligent, and they see what you're spending time on. So if you just maybe weren't seeing our posts and you weren't spending a lot of time on our page, it's not going to be prioritized unless you set that as your settings. So just make sure to do that, so you can stay on top of all of our events and our call to actions.
Great. And then is your news feed the same if you look at, for example, Facebook on your computer versus your phone?
Absolutely the same.
Okay. Just the format of it might look a little different just because of the size of your screen, but definitely the same content.
Yeah, same content, just visually different.
Okay. Great. Dr. John Crossan, who is a member of both PNHP and HCAM, had a great question, and I'll piggyback on it as well. It says, how do we vet the information on a platform? And I think that that is a very valid question, especially in this day of disinformation. Jessica, do you want to answer that, and maybe also just talk about sometimes if you search for a celebrity or a politician, you'll see multiple profiles for the same person. Do you want to speak to that as well?
Yeah, so you want to make sure that when you are searching for, you know, a senator or a rep or a celebrity, that they are, so they'll have a little, and there's an icon saying that they are, I can't remember the term, but they're the right one. Jen, do you know what the term is for that?
The verified. I think it's verified.
Verified, yes, that's what it's
called.
A
green check mark. Yep.
Yes. So you want to make sure that you're only looking at those pages and sharing that content. Definitely. Because that's tricky. You can definitely get into some profiles that are not real, and you don't want to do that. So, yeah.
And then for the information that you see, just keep in mind that social media is available to anyone with any opinion, and there are people who are honest and there are people who are very dishonest. Disinformation, if you've watched the news over the past 5 years, you know that it's a big deal. And that leads to another good question, Jessica. We've heard about people getting kicked off of social media. Is that something that can happen to us? And if so, why?
Yes, it can. So you need to be careful about what you're posting and the content within your posts. So if you share damaging information, use violent rhetoric, or organizing around illegal topics, you can be deleted or your account can be suspended. So you just need to be very aware of what you're posting and also commenting on other ones, what you're saying. Anything out there, just be careful.
And actually, that's a good segue into comments. So we can comment on other people's posts, photos, videos, and anything that we post, they can comment on ours. So Jessica, I know occasionally we'll post something on PNHP, not thinking we're opening a can of worms, and boy, do we. Suddenly we have lots and lots of comments. Do you have any tips for best practices for replying to people that are angry by your posts or want to argue with you? Any tips for that?
Yeah, I mean, you definitely, it's a hard balance. I mean, you don't want to engage in to make it worse, but you definitely need to address it and maybe take it offline or just in a private message and chat with them. And if it's a very, very bad comment, we had some actually after Pride, some people posted some really, really bad things on our page. You can delete them and block them. So if it gets out of hand, definitely do that, because you don't want those kind of people on your page engaging with content for healthcare for all.
Speaking of people who create issues on your feed and on your page, do you want to explain to people what a troll is? We hear about trolls online. What is a troll?
Well, I mean, I think it's just someone that is constantly posting, negative, bad comments on anything. I mean, they don't even really probably care about the topic. They just go on and just start, they're kind of just feeding the fire, and they'll do it on any topic. So definitely stay away from them as well.
Yes, trolls purposefully make trouble. That
Yes.
is their only purpose, is to stir the pot and cause problems. So,
Yep.
and people really like to do that. You'll find them more often than you would expect.
Yeah. Luckily, we have not had any, we're just like on a couple posts, but it's been pretty good on our healthcare posts.
I have a question from Diane. It says, if I follow HCAM once this month and then next month, does this kick HCAM posts up higher in my feed? Or am I restricted to follow once for all time? So how many times do you have to follow HCAM?
So if you go into that setting and you select follow, that will be forever. It doesn't go away. If you don't select follow and you're not spending a lot of time on our page, you're not going to see our posts, because Facebook has that algorithm. They're going to show you stuff that you've been engaged in. So if you've been spending a lot of time looking at like stuff, let's just say for the Olympics, they're going to put that on your feed right now because they know that's going to keep you on Facebook right now. They want to keep you on there as long as possible. So that's why you just need to make sure that when you do sign up and then you find our page, to follow, so that all that content is prioritized.
Great. A question from Dave. What is the best way to suggest our own post to be vetted and shared on PNHP and HCAM's public pages?
Where is that question? Sorry, I didn't see that.
It's in the Q&A. It's in an open question.
Okay.
I'm going to put in the chat to everyone the email address for PNHP. If you ever see a story, a post, if you see a great meme, anything like that, and you would like to see that posted, feel free to email me here.
Yeah, same. So sorry, I was just reading it over again. Yeah, if you want to email, you can email me, you can email Carolyn. She's our intern. She's only going to be with us through the end of the month. But within HCAM, so after Carolyn and I create content, the two board members that approve our content are Ann Jones and Mark Brocky. So you can also email them and they can get it to us. But yes, please share stuff with us. We would love it.
Definitely. And we do try to put things that are shared with us online. For example, if you're following PNHP, we did post, Dave had a letter to the editor that was posted in his local paper. And so we made sure that that was shared with all of our followers.
We did the same. And it was so Dave, I know you're on here as well. It was a really popular post. We actually had some other Healthcare for All advocates reshare it. People were commenting on it. They loved it. So yes, please keep the content coming. We love it.
Great. Ann Jones had a question. She asks, what is the difference between my news feed and my homepage on Facebook?
So they're the same thing. Your news feed, and if I'm thinking correctly. So if I go back to, let me share real quick. So right here, if I go here, this is your homepage and your news feed is within your homepage. So there are other options over here for you to click on, but it's the same thing.
Great. There's also your own personal profile page. And so anything that you post goes on your own personal profile page. And we will look into that more in our Facebook and our Facebook, Instagram, and our Twitter workshops. The next question says, really basic, how do you send a message on Facebook? And so I think this is sending messages on Facebook is a very important feature. And it's something that we'll talk more about in our next Facebook workshop. But Jessica, do you want to speak to the value of being able to send a personal message?
Yeah, I think there's a lot of value in it. You're being able to speak directly to an individual. You can also send group messages. So you could send, share a post with 10 of your friends, or you can do individual, and we'll go over that in more depth. But yeah, there's definitely benefit, and it's more personalized instead of just, putting it out on your news feed, so that the individuals see that you picked them specifically to share a topic with.
Yes. So instead of sharing your content with everyone, it's a good way to have just a one-on-one conversation. And it's a good tool for advocacy because there are so many people that can see what you're posting. Then they can actually, kind of like when we do tabling and you get to have a one-on-one conversation, that Facebook messaging option it's the best way to do that online. So great
Absolutely.
question. Thank you.
Yep. And there's messaging within Instagram as well.
Yes, absolutely. And so both of those platforms offer that. So a great question by Avi on Facebook. How do you separate between your personal presence and your advocacy presence?
That's a great question. Because you're going to be sharing this from your personal page. So unless you have, a business page, you really can't separate it. But we'll go into more depth with this. You can, when you're creating a post, you can send it out to a select group within your friends. So if maybe you don't want to send it out to your family, if your family is just not interested in, but you have a group of like 20 friends who are very interested in this topic, you can select that group and only send it to them. And they're the only ones that are going to see it. Yes. I think that's the best way that you can separate it. Jen, do you know of any other way?
No, I think that's definitely the way to go. Usually on Facebook in particular, your personal profile, it's everything about you. So it's very holistic. So you're going to post about, if you're interested in sports teams or your faith or, local activities and things that you're, and actually I think that's what makes people excited about Facebook is you get to learn so many different aspects of your friends and family and colleagues. But if there are things that you don't want to share with everyone, you do have the opportunity to limit your audience of who sees what on your feed.
Yep.
So.
And you have that capability on Instagram as well. I'm not sure about Twitter, but I definitely will look more into that before our workshop on Twitter. And we'll also talk about on our Facebook workshop about privacy settings on your profile, if you want it to be public or if you prefer it to be private. And so that means only your friends are seeing it. So we'll go into that more as well.
Great. How do you, okay, so sorry, next question. How did you share the information with everyone? And so I think the simple answer to that question is anytime you post anything, everybody can see it. So, all of your followers and your friends, whatever you post, unless you limit it beforehand, is available to see. And to make people beyond your friends and followers see it, that's when you would use tagging and hashtagging. And we're going to talk a lot more about that moving forward. So,
yep. And the settings within your profile, if you have a public profile or a private profile. So yeah, definitely we'll touch more on that on the 18th.
We'll do a couple more questions before we finish up here. Dr. Crossan asked, how can we utilize Doximity as an educational tool for healthcare workers? That's a great question. So Doximity is one of the newer social media platforms. It is only for healthcare workers. So you actually have to prove that you're a healthcare worker to get a profile. And so we are, because it's so new, we're still learning about it. Diana looked into it, and right now organizations are not able to be added, but you are able as a user to post content in a similar way that you can on LinkedIn. To my understanding, again, we're still learning how to use it. But it's the same way on Facebook that you share the different parts of your personality. Doximity is the same. So you can share articles, writings that you have done. You can kind of tag yourself in that. And so Doximity, because it's so specific, as we learn about it, that might be its own special separate workshop for healthcare workers. But yeah, it's a new beast and we're still learning that one. So good question. Will this recording be available? Absolutely. So we will be posting it on our YouTube channels and also sending out a link. So after this session closes, you will receive a survey just asking how you thought it went, what you thought was important and what you would have liked to learn more about. And then we will follow up with an email. It will include links to all of our social media profiles. So you can go to the different places and start following. It will include the link to the video for you to go back and rewatch anything or share with others or just save it for later. And you can do that. And then our future workshops will also be recorded. So if you're unable to attend live, you can view those on your own time. So. Last question here for the Twitter session. Oh.
And you're following a lot of people.
And Ann Jones is following a lot of people. She has a limit of 5,000. Apparently, I had no idea you can only follow 5,000 people on Twitter. We can definitely research how to overcome that. I'm not sure. But we will look into that more, number of people that you can follow, and we can talk about that more on September 1st for sure.
Definitely. I didn't know that there was a cap either.
See, Anne is very, very active on Twitter. And maybe that's one thing that we can also include is people who are local advocates that you can also follow as resources. So Anne posts a lot. She's a great resource. People within this movement, for example, Adam Gaffney posts all day, every day, all the time. And maybe that's a good way to wrap up. Your personality comes through on social media. And how you'd like to be portrayed is important in what you post and how you post it. For example, Dan Rather. Dan Rather has a lot of followers and he uses humor a lot. And that's very effective because I think that a lot of people sign on to follow him on his social media feeds on Facebook and Twitter. It's also powerful when he's not funny. When he gets upset about something, you can really tell. And so there are different people and they have different personalities, and people connect with certain things better than others. So if you don't get a lot of followers right off the bat, it's okay. It takes time. You got to walk before you run, and we'll talk more about that at our future workshops as well. So wonderful. Well, we'll wrap up here. I'm just going to quick jump back over to share a couple of last things with you before we're done for the day. Keep learning. That's the best way to, stay on top of things. Not just the news, all of the news is changing on a daily basis. Stay in the know, be well read. These are some great resources for sites online for you to keep learning about what's going on in our movement. These are organizations that support Medicare for All. And I want to point out that all of these organizations are present on social media. For example, Public Citizen. If you want somebody who is going to say it without apologizing and be cheeky at the same time, Public Citizen is a great profile to follow, especially on Twitter, and they're on top of everything. So we will send this out. We're sending out the slides, so you'll be able to see and find all of these folks in the way that Jessica showed you previously for searching for them. So thank you so much again for joining us today. Be sure to register for the upcoming workshops. We will send out the registration links for those in the follow-up email. And if you have any questions, please be sure to fill out the survey that should pop up after you exit the seminar. We really want to hear your feedback because we want to know how we can help. So be sure to fill that out. Feel free to be honest. And we really look forward to doing this again. So thank you so much to Jessica, Diana, and Carolyn, and everyone who helped put together this presentation. And we look forward to seeing everyone very soon at our next workshops. Thanks so much.
Thank you guys. Have a great day.